Introduce yourself to us again.
I'm Martin Robinson. I'm a consultant clinical oncologist and head of the academic unit here of oncology here at Weston Park.
Smashing. And what's the current situation regarding cancer research being undertaken here at Weston Park?
Well, in Sheffield there's been a dramatic events with the start of the Cancer Research UK Centre, unifying cancer research in Sheffield and recognising our success and the importance of cancer research. So this development, which we're raising money for, the complex therapy unit, whatever the actual title that's been given to the integrated treatment unit, is part of that move forward into even more exciting areas of research.
So, is Weston Park recognised for doing cancer research?
Well, our academic unit has been doing research here for over 20 years and been doing more and more complex trials and studies into patients and patient care. And so it is nationally and in some cases internationally recognised as a centre of excellence.
Fantastic. And what is the desired outcome for this campaign? What is it that we're trying to achieve?
We're building a new integrated complex treatment unit which will allow us to take forward novel treatments which we haven't been able to do before. These include the use of viruses and new drugs, and we're going to be able to use these treatments in patients earlier and earlier in their treatment plan. This is something we haven't been able to do as much in the past through lack of facility.
Great stuff. And how many clinical trials take place each year here, and what would the new unit allow us to do?
Well, we put approximately 1,500 patients into clinical studies in a year in our network, because we serve an area of 1.7 million people who have access to studies and trials and new treatments and a whole range of modalities, be they drugs or radiotherapy. So this new unit will allow us to do this research into what we call phase 1, phase 2 studies, which is very early. So an example, we're about to do a study which will actually give a drug to a person, a human, for the first time ever. And we'll be hoping to do more of those studies in this new unit.
Fantastic. What kind of proportion of cancer patients do we have currently going on to clinical trials?
The figure is really quite extraordinary. It's actually 20%. So 20% of patients with a new diagnosis of cancer actually go into a clinical trial or study, which is a remarkable proof of the success of the NCRI initiative in this country over the last 10 years, and also a testimony to the patient's willingness to actually help us take treatments forward.
Great stuff. What kind of advances have there been in the cancer treatment drugs over the past 10 or 15 years? Well,
over the last 10 to 15 years, since the introduction of imatinib for CML and a sarcomical GIST, there have been an explosion in the use of new targeted treatments which have helped change the management of many cancers. Breast cancer with Herceptin and other related drugs, and lung cancer and head and neck cancer, and a whole series of drugs have found a value and a use which as a result of research.
Great stuff. And have these drugs affected survival rates?
Undoubtedly, in breast cancer, the use of Herceptin has been of great benefit to patients with that particular, the 20% of patients with breast cancer who have that particular target and for whom that drug is of value. The survival from breast cancer over the last 10 to 15 years has dramatically improved in this country.
Smashing. And just finally then, is it expected that similar kind of gains will be made in the future?
we hope that similar sort of gains. It's a steady process of hard work. You never quite know where the gains are going to be made, but with all this new exciting research going on, we fully hope that in 10 years there will be equal benefits in a whole range of cancers from the research that's being done.
That's brilliant, Martin. Thank you very